Mayo here, reporting from elderparentcentral.com, where we have, as always, the mission to help baby boomers and their parents live longer and better. Today we have an important health issue to discuss, and that's the use of blood thinners. This issue is very complex, and this information should not substitute for professional medical advice. There are 4 commonly used blood thinners out today on the market, including warfarin or Coumadin, the older one, and 3 newer ones, Pradaxa, Xarelto, and Eliquis. The 3 newer ones have the advantage that you do not need to have blood monitoring as you do with warfarin or Coumadin. These drugs have a very harmful side effect, and that is bleeding. It can cause internal hemorrhage anywhere from the brain, the gut, from the mouth, through the rectum, or in the bladder. That is why we are having this discussion today. Who are the people who should not take these medications? If you're frail, meaning that you're very debilitated, weak, have multiple medical problems and multiple medications, or you're older and have been falling, or you have a history of internal bleeding or hemorrhage before, you should not take these drugs. Again, before you start, stop, or change any medications, please talk to your doctor. Why do people take these medications? These medications are to stop the blood from clotting after it has been pooling. Blood can pool in the heart. If you have an irregular heartbeat or atrial fibrillation, it can pool in the lower extremities or legs. If you've been on a trip in a plane or a car, or you've had surgery on your hip or knee. That is why doctors use anti-embolism stockings or compression hose. These hose or stockings compress the veins so blood does not pool. After the blood pools and clots, it can travel throughout the body. If it winds up in the brain, it causes a heart attack of the brain or a stroke. The most common symptom of a stroke is a weakness on one side of the body. If it travels to the lung, it can stop you from breathing, and we call this a pulmonary embolus. If it travels to the limbs, like your arms or legs, it can cause you to have an amputation. The 3 classes of people who should not take these drugs are the frail, older population who has been falling, or the population of people who have had a bleeding problem in the past. There are possible remedies or alternatives to these medications. And that's number 1, the use of a baby aspirin. Your doctor may substitute these strong blood thinners with a baby aspirin, or he may order you to have a filter placed in your heart or near your legs to stop the blood clots from traveling throughout the body. This is Dr. Mayo reporting to you from elderparentcentral.com. Thank you.